So good day everyone, my name is Chris Sumawang and I am a student nurse from Tarlac State University from BSN 1B, and for today I will be performing an evaluation checklist about providing a patient a complete bed bath. So first thing that we need to do is we need to know the purposes of our procedure. First is remove accumulated oil, perspiration, dead skin cells, and some bacteria. Also it stimulates circulation and produces a sense of well-being. Also, it offers an opportunity for assessment. And for our preparation, for our assessment phase, first thing that we need to do or we need to assess is the condition of the patient's skin, physical or emotional factors of the client, and presence of pain and need for adjunctive measures before the complete bed bath. And also we need to assess for range of motion of the joints and any other aspects of the health that might affect the client's bathing process. Also, we will need to use the clean gloves during the bath, and also we need to determine any the purposes and types of bath and client's needs, self-care ability of the client, and any movement or positioning precautions specific to the client, and other care the client might be receiving, and the client's comfort level with being bathed by someone else, and necessary bath equipment for our clients or linens. And for our planning phase, first thing that we need to do is assemble our equipment. We do need to have a basin or a sink, warm water, a soap and a bath dish, linens such as bath blanket, 2 bath towels, washcloths such as clean gowns, pajamas or clothes as needed, and additional bed linen and towels if required. And also gloves if appropriate, personal hygiene articles, and shaving equipments, tables for the bathing equipment, and we also do need to have a laundry hamper. And now we will proceed to our implementation phase. So first thing that we need to do first is we need to assess our client. So, sir, ready na po ba kayo sa ating complete bed bath? Okay na po. So wala naman po ba kayong nararamdaman ngayon, sir, na mga pain? Wala naman po. So may sinabi po ba sa inyo mga movement limitations po? Wala naman po. So okay na po ba? Mag-proceed po tayo sa ating implementations po? Okay, thank you po. So now we will proceed to our implementation phase. The first thing that we need to do, we need to introduce ourselves to our patient, and we need to verify the patient's identity. And also we will be explaining the procedure with our patient and why is it necessary, and we will be assessing whether the client has the ability to assist with our procedure. So sir, my name is Chris Sumawang, and I am a student nurse from Tarlac State University from BSN 1B, and I will be your student nurse for today. So sir, may I know your name po? Patrick. Sir Patrick, pwede mo mag-list niyo po? Okay, thank you po. So, Sir Patrick, today po is, bibigyan ko po kayo ng complete bed bath. Okay lang po yun? So, it is very necessary po, sir, to remove accumulated oil, perspiration, dead skin cells, and also to remove bacteria sa ating pong katawan. And also po, it stimulates circulation, and also it provides a sense of well-being, and it gives me an opportunity po to assess po yung inyo pong skin. Okay lang po yun, sir? Okay po. So after that, I will be performing hand hygiene and I will be observing other infection control procedures. And for my next step, I will be providing some privacy for my patient by closing the curtains around the bed and closing the doors to the room if possible. And now we will proceed to the preparation of the client as well as the environment. So first thing that we need to do is I will be asking my client whether he or she wants a family member or a significant other to join us during the bathing process. And after that, I will be closing the curtains and the doors to the room so that to ensure that the room is at a comfortable temperature. And after that, I will be offering my patient a bedpan or a urinal, and I will be asking my client whether he or she wishes to use the toilet or a commode. And after that, I will be encouraging my client if to do or to perform as much personal self-care as much as possible. And after that is during the bath, I will be assessing the patient's skin, areas of the skin carefully. So sir, gusto niyo po bang mag-invite pa po tayo ng family member niyo po during your bath? Hindi na po. So sir, kung kaya naman po ninyong gawin po, halimbawa po is kaya naman pong mag self-care po or linisin po yung isa pong part ng inyong pong katawan, sabihin nyo lang po sa akin para sa inyo pong comfort. Okay po? Okay po. And after that, I will be preparing the bed as well as the positioning of the patient appropriately. So what will I do is I will be lowering the bed in a comfortable working height, and I will be lowering the rails on my side while keeping the rails on the other side of the bed up so that the patient won't fall. And after that, I will be assisting my patient to move near me. So sir, pwede po ba tayong mag-move dito? Okay po. Okay. And after that, I will be putting a bath blanket on top of the top sheet of the patient. And after that, I will be removing the top sheet underneath the patient, starting on the client's shoulders down to the patient's feet. And after that, I will be asking my client to grasp the top of the bath blanket as I pull down the top sheet to down the patient's or down the foot of the bed. So sir, paano ko lang po itong bed blanket? Kaya po? So sir, pwede niyo po bang hawakan po ito kung ano po natin? Top. Okay sir. Sir, ipupull ko lang po yung top sheet po natin, no po? Pakihawakan lang po yung bath blanket po natin. Okay sir, thank you po. And after that, we need to also to take note if we are going to use again the linen that we have removed, we will be putting it on the bedside chair. And if we're not going to use it anymore, we will be putting it on the linen hamper. So after that, we will be removing the gown of the patient while keeping the patient covered with the bath blanket. And after that, we will be placing the removed gown on the linen hamper as well. So sir, tatanggalin na po natin yung inyong pong gown. Okay lang po? Okay po. And for our next step, we will be making a bath mitt with the washcloth. So to do a bath mitt, we will need to do this. And after that, we will be washing the patient's face. So first, let me put the towel on the basin of water. So to wash the patient's face, first we will be washing the patient's eyes with water only, and we need to dry them well after that. So first, I will be putting a bath towel under the patient's head to avoid the bed from getting wet. So sir, taas po lang po natin yung ating dito. Okay po. And now we will proceed to the washing of the patient's eyes with water only, and we will be drying them as well. And after that, we will be to do that, we will need to use the separate corners of the bath mitt with each eye. And after that, we will be wiping the eyes of the patient, starting on the inner canthus to the outer canthus. So sir, ipupunasan ko lang po yung inyong eyes, okay lang po? Okay po, mag-start po tayo sa ano niyo po, eyes. So, pili po tayo, sir. Ano po. And next. Okay, thank you po, sir. And after that is, I will be asking my client whether he or she wants to put soap on his or her face. So, sir, gusto niyo po bang gumamit ng soap po? So, hindi na po? Okay, thank you po. And after that is, I will be washing, rinsing, and drying the client's face, as well as the client's ears and the client's neck. So my client doesn't want to put any soap on his or her face. I will be just wiping the client's face, ears, as well as the client's neck. So sir, pupunasan po yung face. Ayan po. Thank you po. Ayan po. Okay, thank you po, sir. After our step, we will be removing the bath towel under the patient's head. Okay, sir, magaling na po natin. Po. So, comfortable naman po ba tayo, sir? Okay, thank you po. So, after washing the client's face, we will be drying them. So, sir, wait lang po tayo. Okay, sir, thank you po. And now we will proceed to the washing of the patient's arms and the patient's hands. So to do that, we will need to place a bath blanket lengthwise under the patient's arms. We will be starting on the arms of the patient, which is farther from us. So for our next step, we will be washing, rinsing, and drying the client's arms by elevating the client's hands and supporting the client's elbows as well as the patient's wrist. Sir, tatas natin yung kamay. So for our optional step, we will be putting a towel on the bed and we will be placing the basin on the bed. And after that, we will be dipping the client's hands on the basin and we will be washing and drying as well and the patient's hands, and we will need to pay attention between the spaces on the client's fingers. So lalagyan lang po natin yung basin po. Okay. Sir, taas po natin. So, i-wash lang po natin, sir, yung pong fingers. O, yan po. Sir, yan po. Sir, i-isang po natin. I will be drying that po. Sir, that's nice po. Thank you po, sir. Sa pagkakas natin. After that is we will be repeating this procedure on the client's other arm. And after that, we need to exercise cautions if IV lines or IV infusions are present. And we will be checking the flow after moving the client's arms. Sir, kabila naman po. And let's go. Okay. Sir, kaya lang yung hands. Sir, dito po. So sir, now that we're done po sa pag-wash po ng inyo pong hands, gusto niyo po bang maglagay sir ng deodorant or powder po?
Hindi na po.
Hindi na po. So for our next next step sir, we will be I will be washing naman po yung inyo pong chest and inyo pong abdomen. Okay lang po? So first thing that I need to do is I will be placing a bath blanket on the top of the patient's chest. And after that, I will need to fold the bath blanket. I need to fold the bath blanket down to the patient's pubic area. And after that, I will be washing, rinsing, and drying the patient's chest as well as the abdomen. I will be bathing the chest and abdomen, and after that, I will be using a long firm strokes from starting on the patient's chest down to the patient's shoulders, and after that, I will be replacing again the bath blanket from the patient's chest. Sir, mag-start na po akong magpunas po sa inyo pong chest. Okay lang po? Sir, po. And after that, I will be replacing after that is I will be drying the patient's chest and abdomen. And next is I will be replacing the bath blanket on the patient's chest. So for our next step, we will be washing the patient's legs as well as the patient's feet. So to do that, we will need to expose the legs, which is the leg farther away from us. And we will be placing, we will be folding the bath blanket towards the other foot, and we need to make sure that we need to keep the perineal area of the patient covered while we expose the leg. Sir, expose up natin yung leg. Okay na po ba, sir? Comfortable naman po ba? Okay. And for our next step, we will be lifting the patient's leg, and we will be placing a bath towel lengthwise to the patient's leg, under the patient's leg. After that, we will be washing, rinsing, and drying the patient's leg using a firm or smooth strokes, starting on the client's ankles to the client's knees, and finally to the client's thighs. Okay. And after that, we will be reversing the cover, and we will be repeating this step on the other foot of the patient. Sir, try muna po natin yung foot. Sir, yun po. Okay, sir, expose na po yung other foot. Okay lang po ba yun, sir? Release na po. Okay po. Sir, thank you po. After that, we will be drying the patient's feet, and to do that, we will be placing both, excuse me, we will be placing both the patient's feet on the basin of water. Sorry. So sir, start po tayo sa una pong yung leg. Sir, lalagay lang po natin siya sa basin and i-wash po. Wala po? Okay, sir. Okay, sir. Thanks tayo. Sa isang tignan mo natin. Thank you, sir. Yeah. So, expose natin ulit. Ano po, sir? Lang po, sir. So now that we are done on our next step, which is the drying both the foot of the patient, and for our next step, we need to obtain a fresh, warm bath water when now or whenever necessary. So now we will proceed to the washing of the patient's back as well as the patient's perineum. So first thing that we need to do, we will be assisting our client to a prone or side lying position. And after that, we will be placing a bath towel lengthwise along the patient's back and buttocks. And we need to make sure that the patient is covered with a bath blanket as much as possible. So, sir, side po tayo, para po tayo dito, sir. So, comfortable naman po, sir? Okay po. So, sir, I will be placing a bath blanket, a bath towel po sa inyo kung likod. Ano po? For our next step, we will be washing, rinsing, and drying the patient's back, starting on the patient's shoulders, down to the patient's buttocks and upper thighs. And we need to pay attention on the gluteal folds of the patient. So, sir, mag-start na po akong mag-wash po sa inyo pong back. Papunta po sa inyong upper thighs. Okay lang po? Okay. Sir, so... Okay po. Okay, sir. Okay po. So after that, we will be providing the patient a back massage now or after the complete bed bath. So, sir, gusto niyo po bang mag-massage na po now or after po? Now na po. So, po. Still lang po tayo. Sir. And after that, we will be assisting our patient to a supine position. And we will ask our client whether he or she wants to clean his or her perineal area, if he or she could do it. And after that, if the patient cannot, we will be doing it for him or for her. And we need to drape the patient and wipe the area. So sir, kaya niyo na po bang i-clean po yung inyong pong perineal area, or would you like me to do it for you po? So, kaya na po, sir. So, my patient already wants to clean his own perineal area. So, we respect that. And now, we will proceed to the next step. Sir, balik na po tayo. So, for our next step, we will be assisting our client to the grooming aids, such as applying a lotion, deodorant, or the powders on his or her body. So sir, gusto niyo pa po bang maglagay ng deodorant, lotions, or powders? Hindi na po. So with that po, I will be replacing na po yung inyo pong giving niyo po a new gown po. Sir? And we will be putting the linen that the patient is using earlier. And after that, we will be removing the bed, the bath cloth or the bath blanket under the patient. Sir? Sir, comfortable naman po ba tayo? Okay po. So, after that, I will be performing again hand hygiene. And after that, we will now proceed to our documentation phase as well as the evaluation phase. So now we will proceed to the documentation phase. So we need to document the type of bath given, the skin assessment such as excoriation, erythema, exudates, rashes, drainage of skin breakdowns, nursing interventions related to skin integrity, and the ability of the client to assist or cooperate with the bathing, and also the client's responses to the bathing, and educational needs regarding hygiene, information or teaching shared with the client as well as their family. And now we will proceed to our evaluation phase. So we need to note the client's tolerance of the procedure as well as the conduct appropriate follow-up such as determining the conditions and integrity of the skin of our patient as well as the client's strength, percentage of bath done without the patient's resistance, and relate to prior assessment data if available. And that would be all for the giving the patient or providing the patient a complete bed bath. Thank you.